Okay, so that does not look so good. Let me see if I can clean up our screen here. Oh, I see why. There we go. All right, good morning. Let's try this again. All right, here we go. All right, so today we're going to be talking about our thermal image, my thermal image that I just got done, and even some tips here are going to be helpful and very insightful for you in your wellness journey. Okay, so I'll be reading and then I'll be giving you tips. So we're looking at the anterior head pattern. And what we can see here is that it presents with some nasal congestion, sinus pressure, stuffy runny nose. Even though I didn't report that to them, I got this thermal imaging after previously being sick for 2 weeks, having pneumonia and still having like this yucky kind of drainage happening somewhere in my sinuses, kind of deep in my sinuses. There was a bilateral heat pattern evident in the maxillary sinuses located below the eyes, which is related to local irritation in the sinuses and feelings of pressure. And I have been having just some uncomfortableness. The nose is expected to be colder than the rest of the face. It was presented warmer. Again, common with environmental allergies or cold symptoms, and can be associated with skin disorders such as rosacea or dermatitis. Looking at my lateral head here, okay, so you can see these heat patterns here. So this is cold, the blue is cold, and the red is hot. Okay, so this is really kind of important. I know a couple of you watching have a lot of pain issues, but I want to decipher and tell you why this is important here too. Okay, so lateral head, focal hot spots in the TMJ joints in front of the ear. Okay, so even though I don't feel like I have TMJ, when I go and like rub those areas, or if you open your mouth really wide and then close, do you hear any clicking, things like that too? And there's things that you can do that we can talk about even at a later time that can help the TMJ, but I wasn't even aware of it. You know what I'm saying? So a thermal imaging helps me kind of be aware of what's going on. Now the anterior neck, this is kind of important here. So this is why this is important, because this is where the thyroid gland is, and which can suggest function concern, as there's no reported concern, meaning I don't have labs that are thyroid or anything, but symptoms can include fatigue, hair loss, which I am having, weight gain, mood and brain fog issues, constipation, or cold hands and cold feet. Now this is a big deal because so many people get thyroid testing and they never, it comes back normal, or they're on thyroid meds, but it's not actually being as effective as it could possibly be. Okay. If you have any of these symptoms, get a clinical evaluation. And I've been feeling like my thyroid was doing that. There's also bilateral hyperthermic activity seen in the tonsillar, submandibular, submental lymphatic chains in the neck. A primary function of the lymphatic system is to assist in cleaning the cellular environment of bacteria and other toxins, possibly from the sinuses and teeth, to fight infections. Internal toxicity leads to inflammation. Long-term inflammation weakens the immune system. Okay, and this says consider professionally guided protocols to support lymphatic drainage and inflammation. Now, why that's so important, I just want to talk to you for a minute. I had been feeling like even though I sound normal, I can go through my days normal, I just was feeling like kind of yucky, especially at night, and just feeling like my neck was all like just tight and all of this in here. So I just read my report and I'm like, okay, I've got this. What do I know? So I click on a video about head and neck lymphatic drainage, and in 5 minutes, so I was feeling yucky, in 5 minutes. I did this simple exercise. How many of you get headaches every day? How many of you just kind of feel yucky or fatigued or brain fog? Any of that? In 5 minutes, I felt better. I felt better. And it really made me aware, like, oh, you know, this is going on too. And as we go on, you're going to see I probably have some kind of tooth infection or something that's going on in my sinuses that I do need to fix. Okay? And it made me aware too, because I've been working out and I had been coughing so much too, about all this tightness and soreness. And if you've ever had maybe a raindrop from me and stuff like that too, you know, I work in this area, in the chest, and I really recommend you all be massaging kind of between the little ribs in this area. I bet you if you put your hands here right now, you'll feel that. And I've been wearing bras that are probably too tight for me lately too. And all of you bigger chested women can appreciate that. Like, we need to fix this bra issue. Seriously. All right, back to this. Okay. Come on. Here we go. So I've got some lymphatic stuff. My thyroid's, like, just the head and neck alone would have been helpful just to kind of guide me of what's going on and stuff. The posterior neck, let's see if we can find that. Oh boy. All right, look at my posterior neck here. Presents with expected symmetrical hyperthermia, considered normal daily stress in the neck and muscles. Now, here's the thing too. My good friend Tanya, massage therapist, gave me a pretty intense massage the day before. And she deep tissue massage. So I have a feeling too that some of this hyperthermia is resulting in that. I do have a fatty tumor in this area. But we see we've got a lot of thermic, different imaging and stuff too. Let's see. So there is a focal area of relatively cooler hyperthermia seen at T2 at the base of the neck. This pattern can be indication of general underactive or stressed immune system, especially if they're chronic or reinfection colds, infections or colds. Professionally guided nutritional protocols recommended to include antioxidants to support and enhance the immune system, which is the body's first line of defense in internal external invasions. So I really need to get myself on higher dosages of Ninja Red on a daily basis and stuff too. But some of you may be familiar with what's called a Dowsher's hump, and it was really bad until I lost my 50 pounds. But there's this little hump that can happen here, which is a lot of times associated with stress, but now I'm realizing it could be also associated with infection as well. Okay, now the chest and upper back. Okay, there's hyperthermia over the anterior shoulders, more on the left, which suggests lymphatic congestion likely to shorten pectoral muscles and can be improved with better shoulder posture and stretching exercises of the pectoris muscle group. These findings may be consistent with reported history of shoulder pain. Okay, so ladies, and I know one of you works at microscopes every day and stuff who is watching, what happens is, and when you exercise too, or anything like that, these muscles in here can get very shortened. So those good doorway stretches is really, and I'm not just talking about one time a day. This has to be like a common thing we do. Stretching, particularly those of us over 45 and 50 years of age, like this has to be a regular thing we do on a daily basis. Not just our backs, but our whole body as well. Okay, scattered molted pattern of hyperthermia are detected over the chest. These patterns may be caused by a number of conditions, including hormone imbalance. Oh yes, got that going on. Myofascial dysfunction, various autoimmune conditions, food sensitivities, toxicities, alcohol ingestion, and smoking, emotional stress. Yes. So one of the things they find with with thermal imaging is if you drink alcohol on the consistent, you'll actually have, your whole body will just be like a splotchy pattern of this red hyperthermia happening, unfortunately. Okay, upper back. Here we go, back to the upper back. There is a diffuse areas of hyperthermia located upper medial portion of the scapula over the trapezius, left more than the right. These findings are considered with acute or chronic stress or strain on muscles, other soft tissue structures overlaying the cervical thoracic spine. Symptoms of discomfort, yes. So I think that a lot might have been from leftover from the massage. Okay, so let's talk about the breast study. And this is really important. This is how thermography is very important. Now, one of the things with thermography, we can start to see changes. Like I don't want to say there's anything wrong here, but you can see the one side is having more hypothermic issues than the other. So how thermography can be more beneficial in the beginning as preventative health care than mammography is it can see vascular changes years, like 5 years before you would even see anything on mammography. So when you know the area that is inflamed, because all disease, even cancer, comes from inflammation, then we can really work on that area. Okay, so I'm going to read my breast study. There are multiple significant thermal findings seen in the left breast as described below. The right breast appears larger. You all know I'm disproportionate, so that's fine. These notable thermal findings seen in the breast are commonly seen, but they should continue to be monitored for change. There is a light branching pattern seen over the upper regions of the lower inner quadrants of the breast. There are larger, cooler, hypothermic areas seen in the outer regions and denser tissue surrounding the area. They are relatively small areas of hypothermia in the inner regions of the breast and the hypothermic patterns proximal to the nipple. Okay, left breast. These notable thermal findings seen in the breast are commonly seen. Continue. Okay, these branching patterns seen over the upper region of the breast, there are relatively small areas of hypothermia, all 4 quadrants. General significant findings. These findings should be addressed. Impression and recommendation will be based on the number of these findings. There are multiple well-defined thermal patterns, blah, 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 the temperature intensity. So my right breast, low level of concern. The left breast, thermal significant with moderate level of concern for thermal irregularities based on 2 findings as noted above. Okay, so this is giving me some good clues, okay? And then here's the comments. Note, scattered thermal patterns in the breast and tissue can be associated with several conditions such as food sensitivities. Isn't that crazy? Food sensitivities, various autoimmune conditions, recent consumption of alcohol, and in some cases, these patterns are hormone imbalance. These scattered thermal patterns can also be indicative of inflammation-related immune system reactions. Immune system health is critical to our quality of life. Recommendations to preserve immune health include daily hydration, an anti-inflammatory diet. Yes, ladies, this is why I promote the Rev Up program so much, right? In our Ninja Red, and nutritional supplements, plenty of sleep, and regular daily exercise. Thermal patterns in the axillary region, right? So where I have under the arms there, indicate poor lymphatic drainage and congestion. Consider lymphatic drainage therapy, dry brushing, mild massage, or physical activity that moves the lymph, such as swimming and moderate jumping, right? This is why I promote those waiver machines a lot of times for so many of us. Hypothermic areas can suggest relatively dense tissue, as often seen in fibrocystic or dense breasts. The hyperthermia seen in the sternal region, so this area right in here, in the sternal region between the breasts may be indicative of thoracic lymph congestion, which responds well to deep breathing exercise and gentle circular massage. Consult your healthcare practitioner. So they recommend that I do a restudy in about 3 months, because that's where, like, if we're going to see more thermal activity in this area, right, on the one side, then we know, oh, something's going on. And then that I would have an ultrasound and then maybe a mammography and stuff. I am not worried, friends. I'm not worried. I'm just very, very happy to get results, you know, to be able to say, I can't even tell you how much better I feel. And honestly, I loosened up my bra too. I'm like, just doing that lymphatic stretching and then massaging, and here it's like I feel so much better. So if you're getting headaches, if you're just feeling like blah and yucky, I'm going to encourage you to make sure that you're really having all of this open up, and deep breathing exercise, all of those things. So because I got these, I am going to, most likely in June, we're going to be promoting the lymphatic, we call it the lymphatic challenge. I believe over in the guide section, we go through all of that, but it includes doing dry brushing every day. I'm going to suggest that you do rebounding, jumping, obviously walking would be good, the shaking machine, the waver machine every day, hot baths about 3 times a week. I'm going to be using my infrared sauna as well, but just that daily dry brushing. And then of course our Cellite Magic, which is amazing and awesome. It's our massage oil that was particularly used for the lymph system and for our cancer clients. So at our clinic many years ago. But then all these women said, oh, it works great on my Cellite too. So love that product, and there's a few other oils that you can get in there too. So I hope this was helpful. I will download this, so make sure it's on YouTube. Please reach out if you want to join us for our lymphatic, or if you're watching this at a later time, we can get you all the information that you need, and you can order all the tools that you need. It's not super expensive. I want to say less than $100, but that will last you quite a long time, and you can do that for forever if you want. So just a great tool to use if we are women who want to stay as healthy as possible for as long as possible. All right, have a good day. Bye-bye.